Here's another great stretch for the hip, and this is something that's typically a little easier for most people to do on their own at home. We like to work with the glute as one of the stretches, but even more important to that, deep to the glute, is your piriformis muscle. If you've heard about that muscle, it's usually in regards to any sciatic pain, tension, symptoms that you might have in the glute area. So for a lot of my clients, when we do the piriformis stretch, it's a difficult stretch for a lot of people to get into, and it requires some level of mobility even just to work with that stretch. So a lot of times I'll start them in this position, which is very similar to like doing a pigeon pose, but from a standing position. So this is usually about table height or counter height for most homes for people to be able to utilize something like this at their house. So go ahead and swing your leg up there. And so she does that so easily. But what we're trying to do is we're trying to get the leg up in front, and I want the knee or the foot to cross over the body a little bit. So it's like, you're like that, yeah. So it's like the femur or the thigh is more forward in front of you. You're already in an external rotated position of the hip, which is what we want. And so what you're trying to really do at this point is manage your spine straight. Usually on the working side, which is the leg up side, you're trying to take that sit bone to drop down towards the floor. And then we want to lean forward into that stretch a little bit. And you want to try to lift that tailbone up and out a little bit, so you can feel that pulling in there. And as you lift that tailbone up and out, like you want to arch your lower back or you want to stick your tail out, the knee wants to press forward. So it's like we're trying to reach that knee forward, like you're trying to separate between your tailbone and your knee to try to get that separation at the hip between the pelvis and the thigh. And so then you're going to go ahead and lengthen. And if you want to increase that stretch a little bit, you can lean a little bit more forward. We want to try to drop that sit bone down. We want to stick that tail out and separate between the knee and the tailbone. Again, 30 seconds. After 30 seconds, we can repeat this 3 times on each side. But this is usually a very easy stretch to get into to start any of your mobility for the back side of the hip. It's a deep muscle in our hip called the obturator internus. The obturator internus is part of those deep glute muscles that help rotate things. So it's part of the pelvic floor. It's something that I think gets ignored in a typical stretching or mobility program. So that's why we're going to do it. So go ahead and get yourself in a 90-90 position and going that way, yeah, like that. Okay. So once we get into this 90-90 position, we say that because both knees are at 90 degrees. Between both of her thighs, it's at 90 degrees at the pelvis as well. So this is sometimes a difficult position for most people to get in. If you're really tight in this position and you have a hard time sitting upright, you can sit up on top of something like a yoga block just to give you a little bit of space from the floor so that your hips can get in that rotated position. The leg that we're working with is the back leg. So usually in this position, you're facing towards the front leg. And what we're gonna do is I'm gonna have her turn the pelvis. And as she turns the pelvis, she's gonna stay long in the back of the neck. She's using both of her arms as a kickstand. She's trying to focus that belt buckle angle towards this back leg as best as she can. Once we do that, the knee stays down towards the floor as best as possible. And then it's like we want to try to get this sit bone on the back side of the pelvis to also sit down towards the floor. Again, if you're having trouble getting in this position or if you have discomfort in this back knee, you can bend this knee a little bit more and that will take some of the pressure off of it. Feel that? And then that should help you be able to sit that pelvis down and rotate a little bit more. Once you find that working position, you can either keep one hand to the ground to help you be in this kickstand posture so that your spine stays up and tall, and then reach the other arm forward and breathe with the effort that the knee is going down and forward, but the sit bone and the pelvis are going down and backwards. It's like you're trying to separate at the hip between the pelvis and the thigh. So turning that pelvis towards the back knee, reaching the sit bone down and back, pushing the knee down and forward. And then the last thing that you're going to think about is like you want to arch your lower back or stick your tail out. So we call that an anterior tilt. You're going to drop the belt buckle down. You're going to stick and lift your tailbone up and back. And then you're going to try to keep working between the hip and the knee in this position. I know that's a lot of instructions in what seems like a very simple stretch, but you should be feeling some stretching going around the backside of the glute here as you work this. 30 seconds, 3 times on each side. Once you're done, just be gentle, getting your leg up and out of that posture, and you can repeat it on both sides. That's going to be your obturator internus stretch. Once we're in this position, our goal is to work with the down leg again. And so go ahead and turn your foot out and pivot on this knee like that foot wants to be out wider than your knee. There you go. Great.
And then the foot should be
She's got a lot of
flexed.
mobility. This isn't normal. Okay. So belt buckle is going to be forward. This outstretched leg is going to be more towards the side of the body, so that foot position is a little bit in front of the knee and more wide. Turn your foot like this so it goes straight. Perfect. Excellent. Okay, we're going to sit up nice and tall. We're going to tuck that tail again. So if we think about the hands on the front and back of the pelvis, the tail is going to tuck underneath as the belt buckle goes up. As we get into that stretch position, we should start to feel some things happening or tightening in the front of the hip here. We're going to gently start to shift the body towards that wide foot. So we're going to move the pelvis sideways so that we create an angle in this down leg to try to get that stretch up nice and high in front of the hip here. So she's going to continue to breathe as she tucks the tail, lengthen the spine. You can lean on your arm, reach forward with your right arm there, and that's going to help to manage the tension throughout the stretch as you continue to tuck and try to keep this knee out wide, like you want to separate between both knees and lengthen your spine up. And the last thing, you're already kind of in the position, but you're going to move a little forward into the stretch with your pelvis to try to get that tension in that front area of the hip there. So a lot of the focus is to move sideways with the pelvis as we tuck, but we have a little bit of forward movement to get into that front compartment of that hip. So this is going to be one of those adductor muscles or the groin muscles that tends to get a lot really tight in our hips. We're going to hold that for 30 seconds, 3 times on each side, and that's going to be your pectineus stretch.